Hi guys, it's Med by Health Hush. In today's video, we'll be speaking about clinical variants of acute appendicitis. Clinical variants of acute appendicitis mainly depends on different locations of the appendix, which can be of 5 main types, which includes pelvic, retrocecal, postileal, maldescendant, and left-sided appendix. If we see pelvic type, let's zoom in. If you see the pelvic type, usually in these patients, the pain starts from the epigastric region and then it migrates to the right inguinal region or to the above to the vagina. And these patients also can have early diarrhea, which is due to the inflamed appendix irritating the rectum because it's in contact with the rectum and it irritates the rectum. And also these patients might have absence of any abdominal tenderness. And instead of abdominal tenderness, these patients will have tenderness above the pubic symphysis. And for these patients, we can do digital rectal examination where we find tenderness at the pouch of Douglas or the rectovesical pouch. And also for these patients, we find these two signs positive, which is Passois and obturator sign. And also if the inflamed appendix is in contact with the bladder, these patients might have micturition. So guys, if you want to know what these signs means, there is another video which I did about this, all signs of acute appendicitis, and I will mention it down below in the description box. And next we have retrocecal type. Retrocecal type have 4 subtypes in it: intraperitoneal, mesoperitoneal, retroperitoneal, and intramural. Intraperitoneal basically means that the appendix is still located behind the cecum, but it's present inside the peritoneal cavity. Mesoperitoneum means that the appendix is located behind the cecum, but it is partially outside of the peritoneal cavity, which means like behind the peritoneal cavity. And retroperitoneal type means that the appendix is completely behind the peritoneum, the peritoneal cavity. Intramural type means that the appendix is located inside the thickness of the wall of the cecum. And also for these patients, if you see the pain, how this migration of pain occurs from where to where, it starts from the epigastric region and then it moves towards the right lumbar region. And in these patients, we don't find any abdominal tenderness because the appendix is located behind the behind the cecum, and the cecum is accumulated with gas, inflated with gas, and because of this, it's very hard to palpate the tenderness of the appendix, which is located behind the cecum. And also this patient can have positive Passois sign. Let's see the next type, which is postileal type. Postileal type, by the name itself, you can see it means something which is located behind the ileum. So this appendix is lying behind the ileum. And these patients have diarrhea, and also they will have small stools because the appendix is irritating the lower ileum. And also these patients do not have any migration of pain, and because of this, it's very difficult to diagnose this postileal type of acute appendicitis. And also, so they don't have migration of pain, and their tenderness is located immediately after the umbilicus, and it's not located in the McBurney point. So it's located immediately after the umbilicus, maybe right side, yeah, in the right side. And if you see the maldescendant type is also known as the subhepatic type. Subhepatic type, and also for this type, it's mainly occurring with patients who have retrocecal type of appendix, and this appendix is located in contact with the bottom surface of the liver and the gallbladder. And from the name, as I said, subhepatic, you can remember this, that it's something in contact with the liver. So in these patients, since the appendix is located in the bottom surface of the liver or the gallbladder, which means that region is right upper quadrant. And so the migration of pain starts from the epigastric region, and then it migrates all the way to the right upper quadrant. And this point is very important because, as we know, that right upper quadrant pain is also there for acute cholecystitis. And the only way to differentiate acute appendicitis from acute cholecystitis is by this little tiny thing. We should ask the patient anamnesis, the history. We should take anamnesis and take history, and then we can see that the patient says that the pain started initially in the epigastric region, and then it migrated to the right upper quadrant. So in this case, we can identify acute appendicitis very clearly. And also these patients can have nausea and vomiting also. And let's see the last type of acute appendicitis, which is left-sided appendix. Usually, left-sided appendix, from the name itself, you can see that this appendix is located on the left side. So this condition is known as situs inversus viscerum, which means interpositioning of the internal organs, that the heart is usually located in the left, and it now in these patients have on the right, and the liver is on the left, and therefore the appendix is also on the left. So when this patient having appendicitis, pain is occurring on the left side, not on the right side. So guys, that's it for clinical variants of acute appendicitis. Thank you.